I have today declared that the coronavirus presents a public health emergency in the United States.
On January 31st, 2020, the former Secretary of Health and Human Services declared COVID-19 a public health emergency. A few months after this announcement, businesses closed down, masks went on, and life as we knew it changed overnight.
But happening today, the World Health Organization is now lifting the federal public health emergency more than 3 years later.
Fox 43's Sarah Williams joins us in studio with details on what will stay the same and what will change. Good morning, Sarah.
Good morning. So health experts say because the public health emergency has been lifted, it doesn't mean COVID-19 is over. Yes, we're out of the woods, but there are some pandemic era things that will stay the same and others that will change. Take a look at your screens. Here are a few things that will stay the same. Vaccines will still be accessible. The federal government has purchased a stockpile from pharmaceutical companies, and it is expected to last through this summer. Treatments like Paxlovid, which reduces the chances of hospitalizations, will be available. These antiviral medications have also been purchased through the government and will remain free regardless of insurance until supplies run out. Now, here are a few things that will change. COVID-19 tests may no longer be free and will only be available through insurance. There will be a few places that still offer COVID-19 testing, but at-home testing will have to go through your insurance. So call your insurance provider to see if the test is covered or if there will be copays. Another thing that will change is national reporting of COVID-19 will continue until April of 2024. The COVID-19 case and death numbers will no longer be highlighted on the COVID-19 data tracker. However, data will still be collected. Now, Dr. John Goldman, an infectious disease expert with UPMC, says because most of the population has pre-existing immunity, COVID-19 won't go away. It's just becoming more controlled.
As more and more people are exposed each successive year, the disease will become less severe. So as more and more people in the population are not only exposed, but have been infected with COVID 1, 2, 3, 4 times, it'll be much less severe.
Now, Dr. Goldman says if you take a look at the first outbreak of the flu in 1968, the first time exposure is severe. But as we see today, it's just the flu because it has become less severe. Now, Dr. Goldman says measures to protect yourself against COVID-19 remain the same. So wash your hands, stay at home when you're sick, and stay up to date on vaccines. For now, in the studio, Sarah Williams, Fox 43 News.